So what's going on? You're sick?
Yes, I've been having fever and I've been throwing up.
Stomach flu can be pure misery whether you're an adult or a child.
I throw up like maybe twice a day and I can't hold no food in my stomach.
You may be surprised to learn this isn't the kind of flu that can be prevented with a vaccine.
The stomach flu is not the flu. The stomach flu actually refers to a wide variety of viruses that can cause similar symptoms. So basically vomiting, diarrhea, stomach cramps, those kind of things. Somewhere along the line, maybe at school or somewhere else, got a little virus in your stomach and it's causing you to have these symptoms.
Pediatrician Ahmed Bayloni of Children's Physicians Medical Group says many times parents mistakenly assume their child's symptoms are the result of food poisoning. So, how can you tell?
It's very quick after you had whatever meal it was that incited it. Whereas the stomach flu lasts a lot longer.
The main complication of stomach flu is dehydration. Be sure to offer your child small, frequent sips of water.
You want to give small little sips, wait 15 minutes. If they're doing okay, give them another few sips.
Only offer clear fluids to your child. That means no caffeinated drinks, which can make your youngster lose more fluids. Parents of young babies should keep a wet diaper count and make sure their infant is still making tears.
If you get to the point where there's a child and they're refusing to drink liquids and they're still having active vomiting or diarrhea, that's a point where you should call your pediatrician, bring them into the office for it to get checked up and make sure everything is okay.
If your child has intense abdominal pain or bloody stools, you should also see your pediatrician right away.
If the abdominal pain is so severe in a child that, for example, the child is having trouble walking, or they're just not interested in food at all, or there's a very high fever, one of the things we worry about and we don't want to confuse with the stomach flu is appendicitis. If the pain gets worse, okay, so if all of a sudden your pain is like 10 out of 10, or especially if it's down here in the right lower side, or like for example, you're having trouble walking, that's how bad the pain is, that's actually an emergency, okay? And that would be something that I would need to know about right away.
Stomach flu symptoms usually last just a day or two, but occasionally they may persist as long as 10 days.
The good news is that this is usually going to go away on its own, okay? The bad news is it might last a few more days.
To learn more about stomach flu and other children's health topics, visit cpmgsandiego.com or call 877-276-4543.